coronavirus. Thank you, Excellencies.
Thank you, Excellency. I now call upon Her Excellency Prime Minister Sheikh Hasina to share her thoughts.
Thank you very much. Good afternoon to all the SAARC leaders. First of all, I thank Prime Minister Modi for taking this initiative. I also thanks for bringing and hosting 23 of our students from Wuhan along with Indian students during the quarantine period. We need to devise a strong SAARC-wide strategy to fight this public health threat and to protect our citizens. We successfully prevented entry of the virus through strong surveillance and rigorous checkup at all international airports, sea ports and land ports. As of now, we had only 3 COVID-19 imported cases. They have already recovered. There are 2 new imported cases from Europe. We have no local or community transmission of any COVID-19 case. We have set up a national committee to provide guidance to concerned people from all ministries at all levels. We have also undertaken massive awareness raising campaigns everywhere in Bangladesh through all available medias, including social media. My party workers at all levels are active in awareness raising. Local body representatives are vigilant to enforce home quarantine if necessary. We have kept 4 newly built hospitals, including the Kuwait Motri Hospital in Dhaka, dedicated to exclusively deal with COVID-19 patients. In addition, there is one more hospital in Rajshahi to exclusively handle COVID-19 patients. We have also earmarked separate beds in every hospital in all districts to treat COVID-19 patients. A few vacant buildings have been identified where makeshift hospitals can be established in case there is any such need. We also have trained health workers at Upazila levels. School children are also being trained to follow necessary personal hygiene. We have stockpiles of testing kits, infrared thermometers, isolation gowns and masks. Excellencies, I have some proposals that all SAARC countries need to cooperate and collaborate closely to fight this pandemic. We need to force collaboration through our collective capacity, expertise and resources. We are ready to share our capacity and expertise as well as the best practice with the SAARC countries, including providing logistic support if required. To continue this dialogue at technical level, our health ministers, health secretaries and relevant health experts can also have this kind of video conferences to discuss specific areas of cooperation. WHO Southeast Asia Regional Director may be invited to these video conferences. We believe it is extremely important to establish an institution to prevent and fight against any public health threats in South Asian region in future. In our SAARC Charter, it is already there about the healthcare. So we can work together for future, and in future any problem arise, we can work together and we can exchange or share our experience. And Bangladesh will be happy to host such institution if you all kindly agree. Excellency, I really thank you very much, especially Prime Minister Modi, to take the initiative, and also I appreciate that after a long time all the SAARC leaders get together. So it's a very crucial time for all of us. So we have to think about our people's goodwill. So I hope that this will show a new dimension or path to help our peoples of all our country and all the region. Thank you very much.
Thank you, Excellency. I now request His Excellency